So to talk again about autism, so these, again, the diagnosis for this, and again, becoming much higher, but certainly, especially in certain areas. For example, in Tom's River, they had a very high spike in the diagnosis of autism. And there was many people who were saying, well, there's something in the environment down there because there was a whole issue with breast cancer also really increased in that area for a while. People saying, oh, there's something in the environment. But they also had just opened a clinic where they had some, so you were talking about this too, Tilly, you know, where they had some very big researchers coming and doctors who had done a lot of research and studies on this that opened up down there too. That kind of correlated with a huge spike in the diagnoses. So they said, is it because we have people who are better able to diagnose, or is it truly something in the environment? And again, you know, these are the things. It is very male oriented. When they're females can have autism, but when they do, it's usually very severe, the very severe type. I've had female patients with it, and they're very nonverbal, don't like to have any sort of touch. So usually they're the more severe types. But definitely it's much more of a male than a female diagnosis.
Based on my job, when it comes to children and illnesses like autism and stuff like that, there's no limit to what parents will try and do for their kids.
Yeah.
So we always end up taking like the CHOP or like the best place for that kind of illness. So I think that kind of has a little bit to do with why Tom's River, because the clinic opened up and people start hearing this is the best place to get treated. So people start moving into the area because they want to be close to their kid while they get those things.
And that is true, especially if they have resources. Okay, with the inborn errors of metabolism, briefly, you know, again, you don't really need to go into too much detail with these. This is a table too. Just know that these are tested at birth before the newborn is discharged from the hospital, usually like the second day, you know, just before they're discharged from the hospital, they do test for these. And for example, Tay-Sachs is the one you should focus on, of all of them, just that's the only one. And this is, again, another inborn error of metabolism. What do we mean when we say it's an inborn error of metabolism? You know what that means?
Yeah, like a child who must have like some, that can't digest, like for example protein or some.
Some of them are that.
I know it is related to when families are like causing cussings and all this stuff. Like
Well,
I don't think it's
it is seen in certain populations. Okay, it can definitely run in certain genetic populations. Cultural populations. In this case, it's not always GI. In this case, actually, what's happening is there's a you know when you have the neurotransmitters and you have one that fires off and the next one takes up the firing, right? If you want to think back to your, you know, anatomy, but really down to the cellular level of the neurons. So if one neuron fires, the other one grabs it, syncs it up, and goes to the next one. Well, in this case, there's a little bit in the synapses, which is the spot between the two neurons. There's a little bit of buildup that stays there. So it doesn't completely take up that signal, if that makes sense. And that buildup that sits between the two neurons over time causes a neurological breakdown overall for the person. That's what Tay-Sachs is. So it's an abnormal buildup of gangliosides, which are basically the waste product, or like it's that, you know, again, you have the nerve that shoots off, the neuron shoots off, the other one takes it up, and it goes on and on. Well, in this case, it shoots it off and doesn't take the whole bit up. It leaves a little bit in there.
So they don't discharge it.
Well, it discharges the signal, and the signal gets taken, but it leaves a little buildup in between the two synapses, or neurons, in that synapse. So what happens is that sitting in there disrupts the nerve processes over time because it will build up. And over time, they will start to have, eventually, like it says, and usually not right away, but over time, like 6 months to a year, they start to delay. They start to lose any gross motor ability that they might have gotten, which usually they do even start to maybe walk, but then they start to decompensate very quickly. They end up having seizures, brain damage, and death within 2 years of age. And it's not something that we can treat. It is fatal. So there is no treatment for that one. Okay, I'm going to stop here. We can take a break.